Hey guys, this is Dr. Mahajan from Mahajan Medical Center. We're very excited. We got a great guest today, Jennie. And, for those of you who don't know me, I'm a board certified internist, and we do a weekly webcast, every Thursday, and we bring different thought leaders. And today's topic is very pertinent and important as we're going to have the open enrollment for the people who are 65 and above starting on this October 15th. Jennie brings a wealth of knowledge of Medicare Advantage plans, and a lot of you folks who are on Medicare and supplement. And if that works for you, that's great. But if you want to hear her out and see if Medicare Advantage plan will save you some money, maybe that may be something you want to consider. So the question is, what is Medicare? Why we should consider, Advantage plan? Who are the people who are eligible? What's the cost saving? What are the other plans out there? Which the Jennie is with Humana, so that's the plan we have, and we take other insurances too. But Jennie going to talk in general first, and then Humana specific. So let's get Jennie on our webcast and we'll get going. Let's see who is up here. Stephanie said, "Hello, Dr. Mahajan. Love all the information." Stephanie, you're a fantastic follower. Thank you for following our webcast. And guys, just remember, Jennie was very kind today, and she is going to have three trivia questions related to Medicare, Medicare Advantage plans, and she's gonna give for the first correct answer $15 gift card from Publix. So that's in addition to the $25 we do for any comments you put up there, and we do in the next webcast. So just remember that that's an addition. So let's get Jennie and see what she brings to the table. All right, let's get Jennie up here. Hey, Jennie, how are you?
Hi. Am I on?
Yes, you're
um,
on.
okay. Well, thank you so much for having me, Dr. Mahajan. You're fantastic, and I am a follower of your webcast, so I'm honored to that you have me as a guest today. And just this is my first live webcast, so bear with me. But just a little bit about me. I've been working with Humana, doing pretty much exclusively Medicare uh, business for over 16 years now. So, Medicare's changed a lot every year. Things change a little bit, it seems like. And, fortunately, just from doing this for a long time, I've learned a lot. So hopefully, if, anybody out there does have any questions, I can help answer them. So I think
let,
the
let, let,
main,
let's
yeah.
stop you right here. Let's talk about where did you grow up? Did you grow up in Florida, or are you
Oh,
from New England territory?
I'm a good old Yankee from Rhode Island. Um, so yes, I can usually pick up when somebody has, a Rhode Island or a Boston accent. My parents are from Boston, so I don't know why I don't have an accent.
Hmm.
I'm not sure how that happened, but yeah, I moved to Florida. Well, I came here for college and just kind of stayed around.
Hmm.
I don't miss the cold weather,
Hmm.
although it'd be nice if it wasn't 91 degrees in October, but uh, but I love it
So,
down here. It's fantastic.
so do you think Tom Brady came here because you came here too?
I think he followed me.
Yes, I think
Um,
so.
so yes, I'm now a Bucks fan because I mean I'm still rooting for the Patriots. I'm a hardcore Patriots fan, but Tom Brady and he brought Gronkowski down here.
Right.
I mean, I actually the route I run goes right by where he plays golf at the I think
Ah.
it's like the Bel Air, somewhere in Bel
Hmm.
Air. So I'm always looking out for
Hmm.
him. But maybe I shouldn't
Yeah,
say that. But anyway.
yeah, I heard he's buying a house here in Clearwater. You know,
Oh
the
really?
yeah, Derek Jeter kicked him out of his house. So,
Oh man. Well,
all right,
Tom
we're not
Brady,
doing
if you're watching, Tom. I've got a big yard and you can practice anytime you want. So you and Gronk,
All
I'll
right.
serve
So
beer.
let's do we don't want to do a sports show today.
Sorry. Okay.
No, no, I was the culprit. I couldn't resist, the Tom Brady reference. So yeah, we've known you for what, 4 years now. You've been working with our patients, so we're very fortunate to have you, Jenny. Let me bring a slide here, and we can have a context. Let me share my screen. Uh, let's, all right. So, are you eligible for Medicare? So that's a
Yes.
question. We want to ask Jenny. It's a basic 101 Medicare. So, uh, all yours, Jenny. Who is eligible for Medicare? So let's start with that.
So believe it or not, when you talk to people, a lot of times they assume they're eligible for Medicare at 62, and that's when you're eligible for Social Security. But for the most part, people, you know, you're eligible for Medicare when you turn 65. Also, if you're on disability, so technically you can be any age on Medicare if you're on disability. Otherwise, you have to be 65 years old. Okay. And something that I'll mention, because a lot of people don't really know, they're confused. They're like, okay, I'm 64, I'm going to be 65. What do I do? Um, so just keep this in mind. If you're collecting Social Security, then Medicare should automatically send you a Medicare card in the mail about 3 months prior to your birthday. And a lot of times I'll tell people that, and they'll say, oh, I didn't get a Medicare card. I'm like, yeah, check that pile of mail that you haven't opened, because you get solicited a lot when you are turning 65. So if you're already collecting Social Security and you're turning 65, Medicare should automatically send you a card. It's red, white, and blue. Um, and they will send that to you usually 3 months prior. Now, if you're not collecting Social Security, which a lot of people aren't these days, a lot of times people are still working or they're waiting till they're 66 or older. If you're not collecting Social Security, then you actually have to sign up. You have to let Social Security know if you do want Medicare A and B. And also keep in mind that you don't have to be collecting Social Security to get Medicare. So I know there's a lot of confusion there. Sometimes people have Part A of Medicare only, and they wait into, because they're working and they have their employer insurance. So then they wait to get their Medicare Part B because there is a premium for that. And then they don't know what to do either. So that's something, everybody's situation is a little bit different. So I don't know if you have my number on the screen somewhere, but I've definitely helped people apply for Medicare. I have forms that you need, or I can tell you, where to go or what to do, depending on your situation.
Yeah, we're going
So,
to put your number right now, Jenny. So that's a great idea. I'm glad you mentioned that. So, yeah, even if, she's very helpful, even if you folks not sure you want to take Humana, but you just want to find out when to apply if becoming 65. Jenny does not push Humana. She just give you what you information you need. So that's the beauty of talking to Jenny, is free, and she'll give you a advice, when to apply for Medicare. So we'll put your number right now, Jenny, in the comment section, so anyone can access that.
okay.
Let me share another screen, and there's interesting aspect up there. So, you mentioned about 65 Part A and Part B, and then, people are eligible if they are less than 65 as well, if you can get disability for whatever reasons, or if you have end-stage renal disease. So, those are the two conditions where, if you can get it before you turn 65 as well. Do you have any comment on dual eligibility here?
I've just encountered a lot of strange situations over where people don't know if they need to get Medicare, or they're not sure, should I stay on my employer insurance or should I get Medicare? And another option, what's going to be better for me. And I really do try to advise people, what's going to work best for them. For example, I had a gentleman call me, and he's turning 65 in November. He works, he has decent employer coverage. However, his spouse is a few years younger than him. So because of that, if he went off of his employer plan, it really wouldn't make sense for him to get Medicare, because his wife needed insurance. And if she didn't have it through his work, it would end up costing more money. So for him, I actually advised to stay on his employer plan since he was still working, and to just opt out of Part B, which you can do if you are actively working or your spouse is actively working and you have employer insurance. So I get a lot of questions about that too, is do I have to sign up for Medicare even if even if I have other insurance? Am I going to get a penalty? A lot of people think there's still a penalty. But again, if you are working or your spouse is working and you are an active, I say active because not a retirement plan, but if you're actively working and you have insurance through your employer, then, or your spouse has insurance through their employer, you can opt out of the Part B to
That's a
avoid
great
the
point.
Part B premium.
Right. So that's a great point. Let's share another slide, which is mind blowing. The Medicare has 62 million people right now enrolled. So, that's like almost one fifth the United States population. And that's pretty massive if you think about it. That there's so many people on Medicare, and it's a very important program as people get into older age. That's very critical for them that they pick the right parts. So now we're talking of the alphabet soup, Jenny. So let's get you. What does Medicare A, B, and C and D stand for? So let's get your thoughts on that. Let me get you back on the screen. Hold on.
All the letters of the alphabet.
All right. So it's all yours. So
Yes,
what
and
does
here's where it
A, B,
gets, and
C,
I
and
always
D stand
say,
for?
no
Yeah.
matter no matter what. Okay, so when you go on to Medicare, there's two parts. There's Part A and Part B, and hopefully everybody knows what funds Medicare. What funds the most of Medicare? Anybody have a guess? It's taxes.
Uh-oh. The
Yay.
taxes fund stuff.
So right now, you worked, or your spouse worked, paid into Medicare. I'm working. I'm, my tax goes to Medicare. So I'm hoping that these millennials have, if nobody has babies, nobody's going to be working to pay for my Medicare. So they better start having kids. So you've got two parts, Medicare A and B, and that's what it's considered. It's government healthcare. Part A is hospital. Part B is medical. Part C, I don't really hear that anymore, but if you ever hear part, and then as far as what they cover, a couple things. Just people assume, oh, I go on Medicare, that covers everything. I don't need to worry about anything. Well, there's definitely deductibles and co-insurance, and because you have so many really good choices, as far as getting something besides just Medicare A and B. But just so you know, Part A covers hospital. So that's pretty much anything inpatient, hospice, something else medical. So that's going to encompass probably most of what you use. Doctor's visits, MRI, CT scan, lab work, really anything outpatient. And just note that Medicare does not cover prescription under Medicare A and B. And then I'm at the next part where we talk about Part C, like I said, that's Medicare Advantage. So Humana, for example, offers Medicare Advantage programs, which are sometimes called Part C. And what those do is they cover everything that A and B cover you for, and it has your drug coverage. So it's A, B, and D, all included with Medicare Advantage. And I don't know if anyone has a guess out there, but I was just looking at statistics today to see if have a Medicare Advantage plan. And it's 46%, which is almost half, which is a lot. So
Yeah,
that's pretty
46%
impressive.
is a big number, Jenny. Yeah, so what you're saying is a lot of people has
Okay. I'm
opted
not
for
sure what
C.
slide you're on, Dr. Mahajan. So
No, I'm not showing any slide, just you and me. So we'll get to
are
the
you
slide
there?
later. Yes, I'm there. So you're talking about 46% Medicare people opted for Medicare Advantage plan, correct? I think that's what you were saying. And then the
Right. So with Medicare, oh, okay. Um, oh, yes. And just keep in
yeah.
mind that this area of Florida, yes.
Okay. I think your
Can you
audio
hear
is
me?
cutting off for whatever reason. I can hear you, but I'm not sure if you can hear me. Can you hear me okay? Can you hear me okay, Jenny? All right. Let's get the next slide and then we'll bring her back. All right. So the prescription drug coverage is by Medicare Part D. So that's where the drug plans are. The
Yeah,
next piece is she covered what does A cover? Let's give a brief synopsis.
I,
What Jenny was
I
saying.
can hear you.
Oh, you can hear me. Okay. Yeah, I'm
Yeah,
on
I
the
can
slides, so I'll bring you
hear
in
you,
in
but
a
it
minute.
keeps cutting out
Just keep
a
going.
little bit.
Yes. Okay. All right. So, I'm just giving a recap, Jenny, so on what you just said because your audio was a little bit off. So the hospitalization, the skilled nursing, the hospice care, home health care is Part A. Part B covers, as Jenny said, doctor's appointments, outpatient care, um, occupational physical therapy, home health, and preventive services. And then Medicare Advantage, as Jenny was saying, Humana or other plans, also cover Medicare C, and
Oh,
Jenny will go over at length. What's the advantage of the C? Okay, Jenny, while we got you on the C, let's introduce, what does Humana offered, in terms of if people wants to switch from A and B and give over to the Advantage plan, the Humana, what does they gain from that? So let's cover that part. Can you hear me? All right, so let's go back to slides while we getting the link back. All right, here we go. So, so the Humana, is a Medicare Advantage plan like Optum and Freedom and other plans in the area, WellCare, to name few. And out of those, we only take Humana, and we take United, but different product, United Medicare. And if you have any questions regarding what plans we take, you can call our main number 518-0822 and talk to Debbie, our office manager, and she can walk you through that as well. And we'll put Jenny's number up there. We're having a little bit difficulty
okay.
with.
So
Okay,
for the,
you go ahead, Jenny.
for the most part,
Go ahead, Jenny.
yeah, I can hear you.
Okay, go ahead. Talk about Humana Advantage plan. What's the value they add? You, okay, let's go back to slides. I think we're having problem with connecting with Jenny. All right, here we go. So so there's these are the plans we have, and then you can talk to Jenny off air, and she can walk you through what are the advantages, and then within the plans there is the HMOs, the health, and the PPOs and the private fee for service plans. And there's special need plans, and Humana offer all those. And what are the advantages of, let's say, if you go with Humana plan? They have silver sneakers, which is their fitness program. They have vision coverage and dental coverage, and they can provide you at home mail delivery, pharmacy, and over the counter.
They include the Silver Sneakers program, which is the free health club membership. A lot of times you get extras like dental, vision.
Yeah, so as Jenny was saying, you get the dental coverage, which you normally don't get with Medicare and B. Plain, you have to buy a separate policy. With Humana, you can get it built in, and so does other Advantage plans.
One of our programs has free dentures next year. Upper.
Yeah. So let's go over what are the other advantages of going with the you get some of these plans like Humana give you some of the premiums back to you, so that's a saving if you are looking to save money. So you can talk to Jenny about if you are a candidate for that, depending on what plan you pick. And the prescription drugs, you save money because you don't have to get Part D plan. If you go with the Advantage plan. So that's the big advantage of going with the Advantage plan, is that they cover a lot of other extras which you have to get yourself. um, so that's valuable, and some people like the flexibility because there is network you have to be part of in terms of specialists, so it's not for everyone. And that's why it's important to talk to a knowledgeable rep like Jenny, or talk to our office manager Debbie, and see if this plan suits your healthcare needs. I apologize for the connection. We're having some issues getting Jenny on a link today, and so I'm going through most of the stuff what she was supposed to go through. But we'll have her phone number available for you guys to call her if you need more questions regarding Humana or any other Medicare related issues. And then there is the infamous donut hole, which all of you guys know about. And having Advantage plan helps you somewhat, because a lot of those generic drugs are better covered there. And which there's tiers in the Advantage plans too, with the different. Mark had a comment. Let's get Mark up here. Mark is saying Kathy all signed him up. So thank you, Kathy, for signing up Mark. Mark is a great listener of the webcast, and we appreciate Mark listening to our webcast on a regular basis. Um, and let's see. Let me get another slide up here. All right. So these are the different options we have. In terms of the Part D, we covered about the drug plan. D stands for drugs. And let's see. So, there's a lot of other benefits you can get going through the Advantage plan. Um, and
Yes.
and then do
Yeah.
remember the enrollment period is from October 15th to December 7th, and after that that's the time frame. If you want to change your plan, you got to be doing that in that time frame. And Jenny can help you if you think Humana is the right plan for you. If not, then we take plain Medicare with supplement. We also take other plans, Medicare plans as well. So do call Debbie if you have questions
Oh,
regarding that. Um, you know, uh, Let me get the trivia questions in today with Jenny brought. So let's do that quickly. All right. So Jenny had a very good trivia question today. The first one is, what is the standard Medicare Part B premium for 2020? So the trivia question is, what is the standard Medicare Part B premium for 2020? And if you give the right answer to that without Googling, you'll the first one will get the $15 gift card. Uh, we apologize, Jenny couldn't get on the stream. We were having technical difficulties today. So I got Jenny's questions here, or the trivia. So anyone can answer that question, which is on your screen. What is the standard Medicare Part B premium for 2020? We'll get a $15 gift card, the first one to answer that. So, do put in the comment section, and, it's not for the agents.
Dr. Mahajan,
Let's
can
see
you
if
hear
Jenny.
me? Can you hear
Oh
me?
boy, hear you loud and clear. Yeah, I can hear you loud
Yay.
and clear. Can you hear me? Okay.
Yes.
All right, so that's great. I got your first trivia question up there, Jenny. The standard
Oh,
Medicare Part B premium for 2020. So don't give the answer. Don't give the answer. Let people guess. All right. So now we got you up there loud and clear. So why don't you talk about different Humana Advantage plan? See if people, have interest and if they fit in well with those.
yeah. And I mean, if there's any Humana members there and you have an agent you work with, fantastic. I know I saw somebody posted a comment, Kathy Hall signed me up, and Kathy's a really good friend of mine. She's fantastic. So, um, there's a few of us agents in the area. One nice thing is I work exclusively for Humana. So I always consider myself your Humana concierge. So my members all get my cell phone. If you need me for anything, you can always call. As far as some of the
Hold on, Jenny. We got a first answer right. So let's
oh
get them on the screen. So you're $15 short now. Okay, Beverly. Beverly had guessed good, 185, pretty close, Beverly. But I think Vincent, is right on the money, $144.60. I think he
very
Googled
good.
it, but we'll give
Hey,
him
you know
benefit of
what?
doubt.
That's okay. If you use Google, it's all right.
Yeah.
While we're on the topic of Part B, I keep getting that question. How much is the Medicare Part B premium going to be next year? And the answer is we're not totally sure yet. Remember, the government decides what the Part B premium is. Due to coronavirus, there have been some things going back and forth. Is it going to be on hold? Last time I saw the most recent article I read said that it's going to be about $153 a month. I'm not 100% on that, so that's sort of speculation, but nothing's set in stone yet, just to let you know. But from what I read, they're trying, government's trying to make it so that it doesn't go up anything too high. Not 185. We don't want it to be 185 a month. So 144.60 this year, 153 or so next year. That's that's what we're thinking. So just to give you a heads up on that. One nice thing with Humana is, so for 2021, we have a wonderful plan that is, of course, accepted here by Dr. Mahajan, and it actually pays $130 of that Part B for you, and it pays it monthly. So, if the Part B premium is $153 next year, we will pay $130 of that for you, and you still pay nothing to come here to see him, and nothing for your lab work. It's fantastic, and nothing for a lot of most of the generic medications. Something else that we're offering, I don't know how many people knew this, but Silver Sneakers, Humana was actually the first Medicare Advantage plan to offer that in this area locally. And we used to have an exclusive contract with them. So remember, that's free health club membership, and you can go to multiple places, LA Fitness, YMCA. I know, I saw one woman this morning. She's like, well, I normally go to LA Fitness, but due to COVID, she's, not been going, which is fine. It's there for you for free with Humana once you do want to use it. And something else that's really nice. I don't know if you talked about prescriptions at all. I don't know if you got to that slide or not.
So I just touched just the general concept about different tiers for generics and Plan D. They don't need to pay extra, and if you have an Advantage plan, that's covered. So if you want to take it from there.
So one thing so again, our Medicare Advantage plans come with prescription drug coverage, and just a couple of things with that. We have one plan that will cover any tier 1 and tier 2 drugs that are, they're a zero copay, and they're covered even if you reach the quote unquote donut hole. And I know the donut hole or coverage gap can get confusing. But for next year, for 2021, you get $4,130 towards prescriptions for the year. That's based on the total cost of the drug. And after that, you hit what's called the donut hole, and you'd pay 25% for prescriptions. One nice thing that Humana has for next year, if you take insulin, it's certain brands, but they're all brand names. So whether it's the vial or the pen, they're going to be covered at no more than $35 copay, even in the donut hole. So I used to talk to people who, if they were using the pens, like Lantus, for example, there's some other ones I can't think of, but those could be really expensive, and they'd hit that donut hole pretty quickly. Well, now for next year with our programs, you will not pay any more than $35 for those, even in the donut hole. So that's one nice thing with prescriptions that we
that's
have
a
for
great
next year.
thing. We do have a lot of diabetics in our practice, so I think that would be a huge advantage to have the pens even in donut hole at $35. That's a great addition you guys have. Anything else you want to bring up, which are good benefits Humana has in its plan, Jennie?
Yeah, so for dental, we have a program next year, which I think is great, and a lot of my members have taken advantage of it this year. But for next year, one of our Medicare Advantage HMO plans, we will have free dentures. That's complete or partial. I've learned a lot about dental and dentures in the past year or so. So that's a zero copay for complete or partial dentures, and I've got lots of members definitely taking advantage of that. And we do have a pretty good network of dentists too. So that's just a really nice benefit. I think Humana realized that dental isn't something that's normally covered under Medicare. Okay, so none of that stuff is going to be covered under Medicare, but they did add it on with Humana. And again, it's for zero premium monthly, so can't beat that. So we have that, and then the over-the-counter products, that's another benefit that people really like. Depending on your, which plan you have, it's up to $225 quarterly that you get credit. And it's through Humana Pharmacy mail order, and they've added a lot of good products. They've actually added Ensure, they've got Depends, they have toothbrush, thermometer, all kinds of vitamins, gummy vitamins, just all kinds of stuff, even bath safety. So there's a lot of neat items you can get on there. And the women I saw this morning said, well, why doesn't everybody why doesn't everybody just go on this plan? And, a lot of people do. So again, that's, in Florida, especially this area, the Part C or Medicare Advantage plans are very popular. You've got great benefits. I've even had people who tell me, hey, can you look up the benefits? I'm thinking about moving to Tennessee, and I wanted to see if the benefits were the same, because if they're not, I don't think I'm going to move, which is pretty interesting. So, I don't know.
All
Any
right.
questions?
So, I have one question, Jenny, for you. I think why, let's say if I'm 65, though I got another 30 years to get there. Uh, I'm 65 and, I want to see, my provider, and, I call you and, you say, yes, your provider is on Humana. So that's a good, important decision, because they've been coming to their provider for a long time and they want to keep that provider. So that's critical. But, once they've made that decision, and if they come to you, what's your next answer why they should pick Humana over, let's say, Freedom Optum or, WellCare? What's different about Humana?
Well, I'm not going to comment on, competitors, just because won't do that. I will say that I've been with this company a long time, and they treat their members right. They treat their employees right. Um, as I mentioned, I don't know if you could hear me, but the largest Medicare Advantage plan in the state of Florida is Humana. So just one important thing when people are considering their Medicare options is, I do think you may want to consider going with a company that, has been around a long time, uh, that's rated highly, that knows what they're doing. You get me as an agent, you sign up with me. So I've got many members that, call me. They have a question, they want to know the benefits. And I will never tell somebody call customer service. I really don't. I will do my best to try to answer their question or help them with whatever they need. That's part of what I do. So, Humana itself, I mean, again, I don't know if everybody has these. I don't know if you members got these masks, but Humana sent out these Humana masks to every single person that is on any type of Humana medical plan. So that's Medicare, employer. I got 4 of the masks. They sent out care packages to all the folks on Medicare who have one of our Medicare Advantage plans, which was a whole like respiratory kit with a thermometer and sanitizer. For a while, they were sending. I could put something in where people could get, food delivered to their home during June, when COVID was really at its, there was really a lockdown, and so I helped a lot of people who were really food insecure get meals delivered to their home. That was really nice. So they really do. Oh, and by the way, if you're a Humana member, you can actually get a COVID test delivered to your home if you'd like. And it's a self test, and then you send it back. And that's a really nice feature as well. And then anything to do with COVID with our Medicare plans. So I just had one of my members, his wife, was in the hospital for almost a month due to COVID. And, I told him, oh gosh, that's, good thing the hospital copay is only $40 a day, for the first 5 days. And he said, oh no, it didn't cost anything because it was COVID. Humana waived all copays having to do with COVID testing or being in the hospital for COVID. So that's just another nice thing that that they did, which I was
You know,
impressed with.
I think you bring a very good point that that you guys do do a lot of hand holding, not just get them enrolled in the program. A lot of our patients are always happy that they sign through you, or your colleagues, uh, who are Humana agents, and in the if they need any help, you guys are fantastic in responding to that questions, or the needs. So that's a bonus to have you in the team, with the patient care. We're going to ask another question for the trivia, Jenny, and let's see how many
Okay.
people can get that right. So, what do most people pay for Medicare Part A? So, the question is, what do most people pay for Medicare Part A? Is there $10, $100, $200? What do you pay, on a monthly basis or annual basis? So, whosoever get that answer right, Jenny's going to give another $15 gift card for that trivia. So the trivia question is again, here, let's see. She had a question, and I think the answer is obvious. We'll give it to her, but she brought it up. So here we go. So she's saying here. No, there was a more than high. Oh, here we go. So Lily is saying, how do you get Humana? So do you want to answer that?
How do you get Humana?
Yes.
Well, yeah. So if you have Medicare A and B, or you're going to be, 65 soon, or getting onto Medicare soon, you just call me and I'm happy to meet with you. It is COVID, so I can do stuff over the phone. I can help you online, but definitely just give me a call and I will discuss your options with you. And the enrollment part in Humana is easy. Usually it's I like to explain everything and go over all the information, and answer your questions. But the enrollment part only takes about 10 minutes, which is nice. And one other thing I want to mention too, because I feel like more and more people are enrolling in plans online. And I understand that because or they're just calling in. One thing is, it doesn't cost you guys any money to have an agent. So when you enroll through an agent, um, you really get like you get somebody to call if you ever need anything. And I don't know about you, but for me, I hate calling customer service, no matter what the company. I hate calling 800 numbers, and you never know who you're going to get. And a lot of people will tell me it's so nice that I just can call my agent, and we're local. We're not from a call center in Texas or California. We're here. So it doesn't cost you anything to have an agent, and we do a lot of the work for you. We, answer all your questions. So it doesn't cost you anything, so you might as well do it that way. That's just my 2 cents on that. But yes, give me a call on my cell phone, or you can text me or email me,
Oh,
or
I'm gonna put all your contacts in the comments once we get done. So don't worry, we'll have your
okay.
information available, and they can always call our office, and we have your number available. So we got a winner for that question we have in the trivia, that what's the premium for Medicare Part A. So the answer came from Beverly Parkinson. Beverly said nothing. That's absolutely correct. Vincent also got it right, but he hit the button late, so he didn't get another
Oh,
point.
so
But
yeah, Part
congratulations.
A, Part A is funded by tax money, and as long as you've worked enough credits, um, then you qualify for it. Or if your spouse worked enough credits, um, that's how it works. Then you're entitled to Part A. And I do occasionally run into somebody who did not work enough credit hours, or depending on, maybe they moved here from another country and they just hadn't been here that long, or whatever the reason. But if you have to pay for it, it's pretty expensive, the Part A. Um, and again, that's kind of a sliding scale, but it can be like $400, $700 a month. It's a lot. So, but for most people, it's free. It's zero.
Hi, we got your information on our comments. Well, let me make sure it's correct. Is it
Yes.
good? That's good number for you. So anyone who wants to reach Jenny, and you want thinking about Humana, or you just have general question about Medicare, she's a great resource, and you can call her and see if you're a good fit. If you're a good fit, then she can get you enrolled. If you're not a good fit, she will also give you the right guidance. So it's all up here on our Facebook Live, and plus I put that number in our webcast. So wherever you're catching it later on YouTube or Twitch or Periscope, now you can see it on the screen, and I kept it long enough so you can jot it down or you can replay it. So that's great, Jenny. Anything else comes to your mind which you want to share with our listeners about Humana, which is unique and gives them advantage?
Um, I know I talked broadly about benefits and plans, and I know it can be very confusing for people. And really, the best thing to do is just, if you're confused and you're new to Medicare, um, or even if you've had Medicare, a lot of times I'll do these Medicare 101 presentations, and I'll do some trivia questions. And a lot of people say, "Oh, I've been on Medicare for, 10 years. I already understand everything." And actually, they don't a lot of people aren't sure what the Part B premium is, or they don't know what HMO stands for, or the difference between HMO or PPO, or what their options are.
Okay,
So
let me stop you there. What's the difference between HMO and PPO? Let's get that out of the way.
So an HMO stands for, well, HMO stands for Health Maintenance Organization. And the whole idea, health maintenance, is preventative health care. So really that model works really well. The main thing I tell people with an HMO is you want to really like your primary care doctor. So if they go to you, we know they're good. Um, but that is important because your primary care doctor will give you a referral to see a specialist. That's how an HMO works. And when you have a good primary and you like your primary care doctor, then the plan's going to work great for you. Um, you know, that's what I tell people. So as long as they like their primary, great. I'm assuming that everybody who's watching this, if they go to another doctor, and sometimes I'll see people who say, "Well, I don't, my current doctor, I don't know about them." And you want to like your primary. That's very important. So, I've definitely, I have members that come here as patients, and they really love you and how much time you spend with them, and the care that you do give. And that is very, very important, especially when you have an HMO. PPO stands for Preferred Provider Organization. And a PPO, the copays are generally going to be higher. Um, you don't need a referral. Uh, so I will say, there's not one better. People say, "What's your best plan? What is the best plan?" And I got that question today from somebody that I met with, and I said, "Well, that depends on what you're looking for. It depends on who you ask. Everybody has different needs. Everybody has different priorities. So there is no one best plan. It's going to be what fits your needs. And again, the nice thing being in this area of Florida, you've got lots of great options that other parts of the country they may not have. And the reason for that is because there's so many Medicare beneficiaries here. So you just have a whole wide range of plans to choose from. You've got great benefits. I mean, the benefits are crazy good. I wish I could have, Humana Gold Plus, but I'm not quite on Medicare yet. So
Hi, we got your fan here, Jenny, and she has a very important question for you. So let's get her up here. So Sandy is asking, when is the rock painting coming? Lot of love.
So I still have the rocks and the paint stuff in my garage. I don't know. As soon as there's a vaccine and we can do group meetings, maybe when the weather's nicer, we can do something outside. Um, I know. I was also a big fan of the rock painting. Actually, I really started to enjoy it. So I have to say, honestly, I would hope for um, maybe in January, but I'm not sure. So we
Yeah,
will
it's a
definitely let you know.
yeah, it was a hit. Anytime you're doing the rock painting, Jenny, and we had so much response, and that was mind blowing how people got interested in that and they got good at it. By the time you came second or third time, not as good as you are, but but
You know what? I didn't realize I never understood it before. I'm like,
Mm,
I don't understand rock painting. Why is this
mm,
so fun? And it really
mm,
is
mm,
relaxing. I had no
mm.
idea. So
So let's talk about quickly. I think that's a little bit off topic, but I know you're passionate about it. So let's get a little bit more out of you than the insurance spiel you gave us. I know you're passionate about running marathon, and you just finished a grueling marathon. But 43 miles? Which one was
46
it?
miles.
46. Oh,
Yeah.
I'm sorry, I shortchanged you by 3 miles.
Hey, those 3 miles, they count.
No. So tell us, when did you first got interested, and if people wants to get into, for fitness, walk, and give them some tips, if they want to do 5K, let's say 6 months from now, and, they want to get in a program, running a marathon, at a later age is difficult. It's not impossible, but difficult. But, get on a fitness program, walking program, 5K program, give them some, wealth of knowledge. I know you've done Boston, you've done Chicago, New York. What are the major ones you've done?
I did the Marine Corps Marathon last year.
Hmm.
So unfortunately, most races are canceled right now, which is understandable because you can't really have big crowds. Um, I never ran really. I was never really that athletic in high school or college or anything. But when I was 26, I had a DVT, blood clot, and a pulmonary embolism, and just turns out that I have some inherited blood clotting issues. And after that, and I don't know how much it made sense, but I kind of started thinking, well, if I move more, maybe that'll help prevent clotting. And I started getting into yoga, and the nice thing with running is you don't need another person. You just need a pair of comfortable shoes. Actually, there's one guy who runs in flip-flops on the trail, so maybe you don't even need that. Um, but for me, I found it to be just fun and relaxing, and I didn't let the fact that, I have, I get blood clots, I didn't let that get me down. So it just sort of started that way, and I just continued with it. And just like anything else, I don't know, it I guess you run, and you either you do your first half marathon or 5K, and you either love it or hate it. But I tell you, once you get past the first 3 miles, that's when that's when it gets easier. You have to just get past the first three. And it doesn't matter how slow you go. Everybody, I always say in a marathon, everybody's running the same distance. So however you go, there's a lot of couch to 5K programs like Run Walk. So I encourage people to look up those. And if running's not your thing, swim, bike, find something that you really enjoy where you can stay active. I think you'll find, and the doctor can tell you more about this, but your cholesterol will go down, your blood pressure will go down, um, your resting heart rate goes down,
All
and
right,
you will
Jenny, you
just,
stick with your lane.
sorry, you'll sorry, I won't get on the medical, but you'll feel better. So there's a lot of couch to 5K programs that you can do. And 46 miles in the summer heat in Florida is a lot. So I will say that that's a lot. So start small, and it's one of my favorite things. It's like my meditation. So I love it.
Thank you, Jenny, for sharing. I think any kind of movement, as you said, has huge health benefits, and Humana and a lot of Advantage plans have pushed prevention and wellness, which I wish Medicare, A and B also do that too. It's just it will prevent future costs, like stenting or bypass or cancer treatment, even cancers, or anxiety treatments, so all those can be reduced or prevented if you started early like you have been. So, kudos to you that, you had a blood clot and a clotting condition and you kept pushing yourself, and, you've done a fantastic job being a role model for all of us to pick up, get more pace in our, wellness program, and for all our patients too, to think about wellness and walking and movement as integral part of living. All right, so final thoughts of wisdom on Humana, Medicare Advantage. I'll give you a few more minutes to, get things wrapped up, and then we'll do a raffle for the people who did the comments on our last show with, Jasmine, the hospice chief medical officer, and then we'll finish off by the alternate nostril breathing. So let me give you a few more minutes to see if you want to give some pointers or just the final thoughts, Jenny.
So just one other thing I wanted to mention too is some people qualify for, extra assistance to have the state of Florida pay their whole Medicare Part B premium. So we have what are, called special needs plans. So SNP, might say that on your Medicare Advantage plan card. And with Humana, we now have anybody who's on one of our Medicare, Medicaid plans. So if you're on a Humana Medicare plan, which is a special needs plan where you're entitled to help from the state, Humana has sent out, you get a $50 food card that is reloaded monthly with $50 on it that you can use to get healthy food at Walmart, Dollar Store, Walgreens. I know they were trying to add a few others, but I usually recommend Walmart. And it's a $50 monthly card that you get that's included with the plan. And again, that's for folks that have Medicare and Medicaid. If you have those two things, it's a phenomenal. It's a great plan anyway with zero copays for most stuff, but the $50 food card, and then there's like extra vision, extra dental, whole host of extra benefits that you get, and over-the-counter stuff. And if somebody thinks that they might qualify for that, we can actually help them apply for the assistance. Humana has a social services department, so that's just another thing I wanted to mention. As far as everything else, just, I always tell people, if you have questions, everybody's situation is different, and give me a call. I'm happy to answer your questions for you.
Thank you so much for coming to our webcast, Jenny. I know it started a little bit rocky earlier with the technical issues, but then it settled down. So what matters is how it ends well.
That
So
is
we're
true.
gonna-
Thank you so much. You're a fantastic doctor, and we're really happy that you're taking Humana.
Thank you.
So thank you for taking care of our members, and I appreciate that.
Oh, by the way, did you tell everyone that we are number one? If you if you put the 33770 zip code in Humana providers,
Yes, he comes up.
Dr.
Dr.
Meera
Mahajan comes up as
Mahajan as
number
number
one.
one. Yes,
Yes.
so we're very excited and proud that we are number one, and there is a reason for that. The reason is we care to listen to our patients. Not every, if you think about Jenny, not every physician does the patient education. What we have been doing with the social media and all that, and a lot of patients appreciate that. So it's a support from all the wonderful patient, and that's they keep giving the gift of sending their friends and family. And folks, if you have anyone who is turning 65 or they're looking to change insurances and they want to discuss that, here is Jenny's number again. Do give her a call. I think it says Annie, so let me get the other one, which says Jenny. This one says Jenny. So give her a call, and she'll be more than happy to help you. Thank you so much, Jenny. We need to wrap up. You take care. Stay safe. Keep up the good work.
Thank
Bye-bye.
you. You too.
All right, guys. So we're gonna do the last week we had people participate in the uh, in our comments for the the Humana, and we're going to do the $25 gift card from Mahajan Medical Center for people who participated. Here I got the drum here, and I'm going to roll it around and see who is the lucky winner. So let's see who is the lucky winner here. All right, we got the lucky winner. Let me put that away. All right, so the lucky winner is, Anju Sandhi. Anju is a good friend, and congratulations, Anju, for winning $25 gift card. You shared a great story about your dad, and that was very kind of you to share with the community that the grief you went through. And so thank you for being a good friend, and congratulations on winning the Publix gift card. All right, so we're going to do the breathing exercise, folks. So, today we're going to do the alternate nostril breathing. If you guys are ready, we're going to do it right now. So you guys have done it with me before, so it's not very difficult. You put your left hand, keep your spine straight, left hand on your left knee, and then, keep your these two fingers up here. Close your right nostril with your right thumb, and the left nostril you can close with your left the right ring finger. And then you breathe in and close your right nostril, breathe out through your left nostril, and then breathe in through your left nostril, close your left nostril, and then breathe out through your right nostril. Breathe in through your right nostril, close your right nostril gently, breathe out through your left nostril, and that's it. So that's one cycle. You can do 25 of those if you can. It will help you center your mind, relax you, and calm you down. With that, we come to the end of our program. Next Thursday, we're going to have a very exciting guest. The boss of Mahajan Medical Center, Dr. Meera Mahajan, will be sharing her wealth of knowledge about skin cancer and how to screen for it and how to treat it. As you guys know, that she provides that service to all our patients in her office, and she has beautiful hands, and she got beautiful surgical results and cosmetic results with her skin biopsy skills. So we come to the end of our program. Be kind to yourself, be kind to your neighbors, be kind to your other living beings, and biosphere. And we'll looking forward to seeing you with Dr. Meera Mahajan for your skin cancer needs next Thursday at 4:30. Namaste.